The purpose of this quick tutorial is to familiarize the user with entering of the clerical portion of the patient's digital record within the Maestro 3D Ortho Studio. I'm opening with this screen for a simple reason that going to the very first screen that is available usually causes some flicker on playback. So if it flickers or if it doesn't, we're going to New Case, which is right here, and that brings us to the screen that doesn't usually flicker. And this is a screen from which the information is entered into the patient's record, essentially into the patient's label that will accompany the patient's digital models all throughout the process. When the program is first opened up, there is no library to speak of. There is a default clinic or a business, and there are default doctors and default patients. So what we need to do first is establish a new clinic first. So the new clinic will be, let's call it Good Ortho. And we will insert that name into the library of businesses. Let's enter another one. Better Ortho. Let's insert this one as well. And a third one. Best Ortho. And obviously all kinds of information can be entered here as well. The address, the city, and so on and so on. Any kind of notes pertaining to this particular customer. This is inserted as well. And in order for me to make a future point, let me enter one more, and that will be not so good Ortho account. We will insert that one as well. So we have a whole bunch of businesses that we entered. Let's enter a few new doctors. So let's make it a doc A, insert. Let's enter a doc B, and doc C, and again to make a future point, a not so good doc as a part of our record. Now we will also need some new patients, and we'll keep it simple. How about a patient X? We'll insert that patient, and we'll enter a new one. Patient Z. And patient Y. So now we have a whole bunch of information. We have libraries of doctors, clinics, and the patients entered into the software. So as I begin to establish the label for a particular case, I can choose from a whole bunch of choices. I have the good ortho, the bad, the better, the best, and the not so good. Well, let me choose the good ortho is the business from which the case has just arrived, and the doctor from whom this case came is the Dr. A. And having selected the doctor from the library of doctors, I will now click Add to add that doctor from the right column into the left column. What essentially it does, it selects the doctor, it takes the selected doctor from the library and moves them to the label. That name is temporarily removed from the library. You see that Doc A is no longer there because that name was moved from here to here. Now we will need to select a patient. We selected a bunch of patients, so let us select a patient X. We selected the patient, and now we're going to add that name to the label that will accompany the digital model. And once again, once the patient is selected from the library, the name disappears from there and appears here. So these were the selections for the label to accompany digital models. If I notice that I made a mistake by deleting the name from here, I am deleting the name from the label, and that name reappears in the library. I can choose a more appropriate name to add, and I'm going to have to re-enter the patient's name and add it exactly the same way. So now, once again, my record is ready to go. If in checking it, I once again realize that now I made a mistake with the patient, I can select this patient and delete the patient from the label, and the name of the patient will reappear back in the library, and I can choose the correct patient's name to add to the label. So here we have all of that in place. Now, it's worthy of note that there are delete buttons on this side as well. Now, these are the deletes not from the label, but from the library. So if I choose a particular patient, let us say a patient Y, and I can choose to delete this patient Y, and now this patient is completely gone from the library. If I have a particular doctor that is no longer associated with the business, I can delete that particular doctor from the library, and that name is no longer available there. And by the same token, I can take the business that was not so good to begin with, and I can delete that business from my library of businesses. So now that we learned about these buttons, let's once again select our label. We have the good ortho, doc C, patient Z, and we're ready to go. The next button will take it to a screen where we can make some selections as to where the digital data is coming from. This icon right here, open file from disk, takes us to a place where we are looking for a particular digital file. And let me just see if there is one. Let's see. Google and digital models. So as you can see, what this search caused me to find are a couple of files with extension of .stl. The reason it is so is because this particular lookup is only looking up and can only look up the .stl formatted files. So I'm going to just jump out of here momentarily. In contrast to this lookup that looks for the .stl, this particular lookup, though titled import, also looks for digital files, but what it's looking for are the files in a .ortho format. The .ortho format happens to be a proprietary format for the Maestro software. So I'm going to cancel out of this as well. So I guess if I were to rename this file or this icon, it probably should be renamed. Here you look for .stl files. And this, while called import, should probably be renamed. Here you look for the .ortho files. So, and this particular button is the button that activates the scanner. It means that you do not have the files on hand somewhere in your computer yet in neither the .stl format or .ortho format. We're going to have to make our own files from the scanner. I'm going to click that, and it initiates the wizard through the Maestro 3D dental scan. So I'm going to cancel out of that and leave that operation for the moment. So here we are. If there is a file that is available for me to find, and I know that it is in a .stl format, I can go and chase it down. And here is my maxillary model. It's brought in on the left-hand side of the screen. I can turn it around, making sure that that is the model that I was looking for. There is an identical set of icons on the right-hand side of the screen, and toggling this one will take us to the very same folder where the maxillary model STL was found. So now we're going to select the mandibular one. We're going to open that, and it is introduced on the right-hand side of the screen, and here is the lower model. So if this happened to be the models that I was looking for, I can just click Next to accept, and the models will come up on the screen. I'm going to turn off some of the unnecessary stuff here, and here is the model. I can double check again that it is the model that I was looking for. Now this happens also to be a point in time where one can adjust the local origo or spatial orientation of the models. I'm gonna do the next tutorial on that, but for now let me just click through that and accept the models as they are and save them. And here are my models, and here is my label that will accompany the models all throughout fabrication. The good ortho, doc C, patient Z. Some of the patient information that I did not fill out during that initial introduction of the doctor's names and the patient's name happens to be blank. So that's why it is important to have that filled out completely. So here it is. Thanks for watching.